Hi, my name is Jose, the hygienist with Dr. Plummer. I want to talk to you about gingivitis today.
Around every tooth is healthy gum tissue. But if plaque accumulates around the neck of the tooth, and especially between the teeth, the gum tissues will become swollen and red. This condition is called gingivitis and is an early stage of periodontal disease. When this happens, you may see some bleeding when you brush or floss. Swollen gums create a pocket around the tooth, allowing more room for plaque to form and make it harder to remove. Bacteria also accumulates in the space and eventually results in the loss of the supporting bone and loss of teeth. This is why it is so important to treat gingivitis to reduce gum pockets and to allow for effective cleaning around each tooth.
Some of those symptoms are red bleeding gums or bad breath. If you think you have some of those, come and ask me or Dr. Plummer, and we'll see you in the back.
The Chicago Bulls have won 6 straight against the Wizards, and their MVP tonight should be motivated to continue that streak as he goes against John Wall. Derrick Rose missed a pair of free throws late as the Heat took down the Bulls a day ago. First quarter, it's Derrick Rose with the ball, the Bulls with the lead, and the nice dish to Carlos Boozer for the Jam. Boozer 9 of 16 from the field. Then it's Derrick Rose getting by John Wall, getting by the rest of the Wizards defense, and getting in for the layup. He was 10 of 20 from the field. Chicago up 12-6. Later in the first quarter, Kyle Korver missing, and we go the other way with the Wizards. And watch the quickness and speed of John Wall. And then a little floater. Yeah, finishes with a floater. He scored 20 on the night. Chicago up 14-10 later in the first quarter. It's Rose driving and putting in a floater of his own. He had 13 points in the first quarter. The Wizards had 16 points in the first quarter. Chicago up 21-10 at that point. Into the second quarter we go. Ronnie Brewer missing the layup, and we go the other way. Washington on the run once again, and John Wall all the way to the rack for the layup. That cuts the lead down to 6, 36-30. This time Wall passing to JaVale McGee. Easy little alley-oop jam there. McGee had 16 points, 9 boards. Chicago up 38-32. Later second quarter, Joakim Noah drives and finds an open Kyle Korver, and that spells trouble for the Wizards. He was 5 of 12 from deep, and Chicago's lead a dozen at that point. Into the third quarter, Chicago playing some defense. Derrick Rose gets back and blocks John Wall. We go the other way with Derrick Rose, who turns on the Jets, gets by the defense, misses the layup, but there's Joakim Noah hustling for the tip in. He had a double-double, 14 points, 13 boards, and Chicago up 17. Derrick Rose again driving, putting in the floater. The Bulls extend their lead to 21. Later, Chicago working it around. This is Derrick Rose's only 3 of the game. He had a season-high 35. Chicago up by 22 as we take you into the fourth quarter. Washington trying to put together a little comeback. JaVale McGee on the offensive glass. Hoop and harm there. That cuts the lead down to 13 after he made the free throw. But just too much Chicago. Derrick Rose again passing to Carlos Boozer, who hits the jump shot. He had 18 points and 8 boards. Chicago goes to 18-5 on the season. They win this one by 10. Final score 98-88.
Hi, I'm Dr. Plummer. Welcome to Maxwell Dental. If you have a large filling or broken tooth, or maybe you've had a root canal, you may need a crown.
Crowns. Teeth that have broken or have large defective fillings can be restored to proper form, function and appearance with crowns. Crowns are often needed for teeth with large metal fillings. Over time, the force of biting and chewing can cause a large portion of the tooth to break. 2 appointments are usually needed for crowns. Because the shape of the prepared tooth assists in the retention of the crown, it is often necessary to build up the tooth. At the first appointment, the tooth is prepared to accept the crown. An impression is taken of the prepared tooth. A temporary crown is placed over the prepared tooth, ending the first appointment. The impression is used by a lab technician to make a model on which the crown is made.
So, if you have any of these symptoms, ask me about it. I'll see you in the back.
Sensitivity. What causes receding gums? Is it A, periodontal disease, B, toothbrush abrasion, C, toothpicks or fingernails, or D, all of the above? Well, the answer is all of the above. Every tooth has a crown and root. The root is embedded in bone and the bone is covered with gum. For various reasons, sometimes the gum recedes or pulls away from the tooth, exposing the root. If this happens, you will most likely notice 2 things. The tooth doesn't look right because it is longer, and it's more sensitive to hot, cold, and sweets.
Hi, my name is Jose with Dr. Plummer. Are you afraid to drink a cold glass of water? Do you dread eating ice cream because your teeth are too sensitive? Well, we have a treatment called desensitizing. Maybe you're brushing your teeth too hard. Your gums are probably pulling away from your teeth. That's also causing you some sensitivity. Ask me or Dr. Plummer about those problems and what we can do for you. I'm Jose. I'll see you in the back.
There will be some severe weather over the weekend. Not a very big chance for tornadoes, but along a frontal zone, we will have some severe weather. A little ways, the low pressure will run along that zone. A warm front here ahead of it, stalling out front behind that. In the areas south and east of those frontal areas, a lot of warm, moist air from the Gulf of Mexico, but it's capped. Some warm air aloft that will try to inhibit the storms, except probably right near those fronts where the air collides and then gets forced upwards. The jet stream will carry some of the cold pocket that gave the severe weather threat on Friday farther north, so it probably not much of a factor, but some strong winds aloft may steer some clusters of thunderstorms along and just a little north of those frontal zones with hail and a low chance of a tornado, some spotty damaging winds, but a big area anywhere from parts of West Virginia across the Ohio Valley down into parts of Oklahoma and Texas. Perhaps a chance of a tornado or 2 along the way. Sunday, kind of the same kind of a setup along that stalled out frontal zone. Again, from west parts of Kansas, southern Missouri, down into maybe even parts of southeast New Mexico, with probably the tornado threat on Sunday being highest down there at that southwest edge of the red area. Stay safe and have a good weekend.
We all know it's very important to clean our teeth. In fact, cleaning your teeth is one of the most important important personal hygiene functions you should perform, and you need to do it at least 2 times every day. The whole process should take at least 2 minutes, spending at least 30 seconds on each quadrant of your mouth. Truly effective oral hygiene consists of cleaning every surface of every tooth. Every one of our teeth has 5 sides. We have the cheek and tongue sides. We also have sides in between our teeth, and then there are the biting surfaces. Toothbrushing will adequately clean the biting surfaces and the tongue and cheek sides of each tooth, but floss and other similar products are used to clean between the teeth. When cleaning the cheek and tongue sides of the teeth, place the bristles at a 45-degree angle to the teeth. Then apply just enough pressure to slightly bend the bristles. Move the brush in a circular motion for a few seconds, maintaining that slight pressure so the bristles can break down the plaque. Use an upward and downward stroke on the upper and lower front teeth. When brushing the tongue side of the back teeth, use the same method. To clean the tongue side of the front teeth, hold the brush in a vertical position. Apply enough pressure to allow the bristles to spread. Move the brush in a circular motion to clean effectively. To clean the biting surfaces, place the brush directly on the teeth. You need to apply enough pressure to allow the bristles to spread, then clean by using a forward and backward motion. Dental floss is used to remove the plaque that forms between the teeth. There are many varieties of floss, but you need to choose whichever one works best for you. To begin, wrap the floss 2 or 3 times around your index fingers, leaving a span of about 3 inches between them. Push the floss gently between the teeth, making sure it reaches below the gum line. Gently sweep up and down, pushing the floss against the sides of each of the adjoining teeth. Before moving to the next couple of teeth, reposition the floss between your fingers to obtain a clean length of it. To ensure good cleaning of the front side of the back teeth, use a gentle up and down sawing motion. Reposition your floss and apply the same cleaning motion to the back side of the front teeth.
Everybody wants whiter teeth nowadays. They go to the store and spend money on mouthwashes, toothbrushes, rinses, strips, all kinds of things. Let me tell you something. The best place to get your teeth whiter, it's here with Dr. Plummer. Once you come into the back, we can tell you more about the Whitening for Life program. Easy, simple, inexpensive.
Whitening. The best ways to brighten your smile can be found right here in your dentist's office. The first way is with at-home trays. Thin plastic trays that fit your upper and lower teeth are filled with whitening solution. Many people wear the trays at night, but they can be worn at any time. Usually in about 7 to 10 days, you will have a much whiter, brighter smile. Is there a quicker way to whiten my teeth? Yes, possibly. Our staff will inform you of the latest techniques. Does everyone have success with whitening? Most people experience dramatic results. Only a very small percentage do not. How long does whitening last? Whitening usually lasts 6 months or more. Diet and habits can affect longevity, but touch-ups can be done to keep your smile bright. Your smile is one of the first things people notice about you, but over time, its brilliance can dim.
I've been coming to Dr. Plummer's office for over 8 years now. I've been getting my teeth cleaned here. I've been referred by friends. I have family coming here, and I recently got engaged, and we were talking about doing some things for my teeth, so they've been doing a great job for my teeth, and I feel like I'll have a big and bright smile for my wedding. So I'm glad Dr. Plummer, we were able to work together, and I love coming here, I love the staff, and I'm able to get everything I need done here.
Our in-the-chair whitening can restore a healthy, brilliant smile safely, conveniently, and easily. In-the-chair whitening is accomplished in 3 steps. First, we give you a pair of special glasses to wear. Then, we paint on a protective gel to cover your gums. The third step is the actual whitening process. We'll paint a whitening gel onto your teeth and position the whitening light. When it's all properly arranged, we will dim the room light and turn on the whitening light. In about an hour, you'll have a brighter, whiter smile.
Once again, I'm Jose with Dr. Plummer. I'll see you in the back.
Dr. Terry Lyles. He's a psychologist focusing on stress management. He's worked in the past with rescue workers in and around Ground Zero and the Air Force Space Command. It's important to point that out because he's worked with people who have been under these dire circumstances. So, Doctor, listen, tell me what you make of these pictures, and we've been having this conversation all week. Tell me something new that I haven't heard by watching the news all week on this story.
Well, I mean, what I think of as I debrief these individuals going back and forth on a regular basis, I mean, they're in very difficult circumstances, and many of these warriors are very young in age. And when you add that together and you add the adrenal fatigue that goes on with having to be on high alert all the time, your body begins to beat up on you chemically, and it can cause you to have lack of judgments, make poor choices, as we saw. I by no means condone what they did, but I understand to a degree because our people are warriors.
Yeah, stop right there. I think you bring up a very good point. No one, Doctor, is condoning what these men and women did.
That's correct.
In these photographs. But for us to sit here in an air-conditioned studio in our cars and say, oh my gosh, I am outraged. These are otherwise people who went to war or donned a uniform for honorable reasons, and they are basically living in hell.
Yes. Well, Don, the way I look at it is they are warriors, and we call them warriors. In other words, they have a warrior mentality or a hunter mentality. These individuals are in dire situations day and night. Life and death is at their hands every single day, and they are hunting down and trying to eliminate insurgents that are trying to eliminate them. And every victory lane I've been in, there are trophies. And what I see in those photos are these guys looking at the trophy that they caught. Does it justify it? Absolutely not. But I get the mentality of it. And I think part of it is we need to do a better job, with them psychologically to help them understand that the world is watching. Be careful about what you do and what you capture while what you're doing every day is very difficult.
Before I move on to just a different part of this, then what do we do? Because that sort of behavior happens on the battlefield, and as I call it, hell, because we know wars are hell, right? So what happens when they come home? They can't do that sort of thing when they come home, even if they've seen the worst in battle. What do we do?
Don, that's a great question, because I actually have a program that we just got started up that's helping warriors transition back into a civilian or peaceful lifestyle. Because if you don't help them transition chemically, psychologically, they actually end up trying to act out in other ways. Buy motorcycles, drive fast in cars, because they need that rush again. So we have to do a better job debriefing these individuals and helping them reacclimate and transition into a peaceful segment of life like we all have here and enjoy.
Yeah.
Hi, I'm Dr. Plummer. Welcome back. If you have a missing tooth and you want to know how you can replace that tooth, there are two permanent ways of doing so. One is a bridge and one is an implant.
Missing teeth. Bridge. Why should missing teeth be replaced? The two main reasons are appearance and dental health. Teeth adjacent to a missing tooth will tend to drift into the space. These areas can collect food and plaque easily, which can lead to decay and gum disease. Teeth opposite the space can drift into it, causing more problems. For a bridge, the tooth is prepared to allow space for the finished bridge to fit over the teeth properly. An impression is made of the prepared teeth. A temporary bridge is then placed, ending the first appointment. The impression is used by the lab technician to make the bridge. Bridges are usually made of a porcelain exterior for aesthetics and a metal interior for strength. At the second appointment, the bridge is cemented into place and excess cement is removed, ending the procedure. Missing teeth, implants. If you want your new tooth to be as close as possible to the real one, implants may be the answer. It's a completely artificial tooth, roots and all. A tooth-shaped abutment is attached to the implant and the technician makes a custom-built crown to fit onto it. Once your crown is cemented on, your new artificial tooth looks just like a natural one and your smile is as good as new.
So, if you have a missing tooth and you're interested in one of those options, ask me about it. I'll see you in the back.
Hello again, this is Jose with Dr. Plummer. Let me ask you something. Are you familiar with sealants? You have children? Then you probably are. But let me tell you something else. Adults are as important in getting sealants to prevent cavities from developing on those teeth. One of the reasons that we are doing preventative work as sealants is to prevent cavities from forming on the back of your teeth and also the introduction of fluoride, which helps you mineralize those weak areas. Nowadays, people are drinking bottled water. There is no fluoride in the bottled water that we drink. So we need to put more fluoride in your mouth to, one, mineralize your teeth, make them stronger, and also reduce the bacteria in your mouth, thus preventing more cavities from forming. Ask me or Dr. Plummer what we can do. Do you need a sealant? We can let you know. My name is Jose. I'll see you in the back.
Hi, I'm Dr. Plummer. If you don't like the size, shape, or color of your teeth, the veneers may be your best option.
Veneers. Veneers are thin, custom-made pieces of porcelain that are bonded to teeth to improve shape and appearance. 2 appointments are usually required for veneers. At the first appointment, a small amount of tooth is removed to make room for the veneer. An impression is taken of the tooth or teeth. A temporary restoration is placed. The lab technician uses the impression to make the veneer. In about 2 weeks at the second appointment, the temporary is removed, then the teeth are cleaned and the veneer is bonded into place.
So, if you want to know more about veneers, then ask me about it. I'll see you in the back.
Hey guys, we're in Morocco with Jennifer Lopez.
Hi.
It's an extra exclusive event. AJ traveling halfway around the world for Jennifer's giant Casablanca concert as La Lopez gives us some one-on-one FaceTime. Our camera's rolling the entire time. J-Lo pulling up in a cart, boyfriend Casper right by her side. Fans going crazy. Only our eyes on this, J-Lo's pre-show ritual, a prayer and then a cheer. Best show ever! Jen gives her dancers a good luck kiss, then it's showtime.
Hi, baby.
How exciting is this?
It's fun. It's fun. We're in Morocco.
All the extras on the stage as Jennifer takes the stage at the big opening of the Morocco Mall.
Yes, this is how you open one of the world's largest destination malls. You get J-Lo to perform. Everyone screaming for J-Lo, and she gave the love right back. And the Love Fest continued after the show.
Jennifer, we love you. We love you. Thank you so much.
How much fun is this, Morocco?
Oh, it's so fun. It was a good night.
Is your first time out here?
It's my first time in Morocco.
It couldn't get bigger than this.
I know, it was insane.
Where are you off to next?
I go to Peru for Que Viva.
Oh, okay.
And then Chile.
And how much are you loving doing Que Viva and looking out for new talent all over the place?
I do love it. I really, really do love it. It's such a different type of show. We're really unearthing talent and going out there and looking for them and finding them to put together this great Latin show.
And I have to say the AMAs, that performance.
Yes.
Look at the face. You already know I'm going to talk. You looked amazing.
Oh, thank you. I thought you were going to say the performance was great.
It was great. I was saying.
You want to talk about my outfit.
The outfit. Who picked out the outfit?
My stylist did.
Well, she's smart.
Okay.
Extra came all the way out here because you're a star that we love. You know that?
Thank you.
And I got to give this to you because you're a star that we love.
How many of these are you giving out?
This is my first. First ever.
Oh,
This is what you say when I give you something. This is the first time I've given anybody.
Stars, plural.
I'm just stars we love. You're stars we love.
Thank you, baby.
My name is Jose. I'm the dental hygienist at Maxwell Dental Spa and Wellness. We are located in Pearland, Texas. I have been here for approximately 10 years now, and working with Dr. Plummer has been really a pleasure and an honor. She's really a great dentist. She's honest, sincere, and more than anything, she is a people person. You come to our office and we're gonna make you feel comfortable. We're gonna treat you as a person, not a number. We get to know you just like you get to know us.
I've been practicing dentistry for about 12 years now. I think the reason why I love the practice of dentistry is because I'm able to transform my patients' smiles and take care of their dental needs.
I've been coming to Dr. Plummer's office for 4 years now, and she has completed all the top teeth, crowns on every one, and working on the bottom teeth. She does my cleaning, and I really like coming here. I feel comfortable. And I know everybody here. Feels like family.
My experience has been one similar to that of a family relationship. Dr. Plummer and her staff treats me and my family just as if we're born into her family.
I know for my patients, time is valuable. So what we've been able to do is keep all of our dental services in one location, from general fillings to periodontal maintenance, to oral surgery, to orthodontics. We do all of it here at Maxwell Dental.
One of the things that I like about working with Maxwell Dental is that we don't have to refer you out. Some of the specialty work that we do here can be done in office. There's no need to send you somewhere else. Most importantly, you are going to be pain-free. We are going to make sure that you are comfortable during the whole procedure.
I've been doing dentistry since 2000, so it's approximately 13 years. My specialty and interest is in oral maxillofacial surgery, concentrating on implant surgery and complex bone grafting procedure.
I can say to any person who needs dental care that Dr. Plummer's dental care is probably the best in Houston that I'm aware of. And I strongly recommend her. I hold her work in high regards, and so does she. She has good service, good care, good warranty. She backs up what she says, and I strongly recommend her.
So give us a call for complimentary smile consultation at 713-436-2522 or check us out on our website at maxwellodentalspa.com.